And if you can share with everybody, did you have any previous history of smoking, vaping, asthma, or other that could have contributed?
I have never smoked, never vaped, never had pneumonia. In fact, the last time I felt ill at all was over 30 years ago. And I think that was one episode of flu. Other than that, I never missed one day of work because of illness. Generally, my health has been quite good. I wear a cell phone and health app on it. Says I walk average 1 to 2 miles a day. Some days, of course, more.
Awesome. And so would you say that you were in extremely good shape at the time that you got exposed?
I don't know if I'd call it extremely good, but I'd say, good shape. I've never had health issues. I felt very comfortable, normal appetite, maybe above normal. Thirst was fine, slept fine, had a pretty balanced diet. So seemed normal.
Someone's asking if there were potentially any other illnesses or disease processes that you have going on in your body, cardiovascular disease, diabetes, anything like that.
The only history in that area would be about 10 years ago, I had heart ablation for supraventricular tachycardia.
Okay.
Other than that, age 3 or 4, I had rheumatic fever. That's about the only thing that could be related.
And so what symptoms did you have early on, and how did they change as the progression of the infection went on?
I got off the ship 3 weeks ago today, February 21, Friday. That Monday, the 24th, I had one brief episode of diarrhea. On Tuesday, the 25th, in the afternoon, I thought I felt a bit of a chill, but did not take my temperature. Wednesday, the 25th, in the afternoon, I had that chill again, did take the temperature. It was 99.5. The Friday, the 28th, had 2 short episodes of diarrhea, and then that was it for diarrhea. Okay. But continued to have the afternoon and evening fever, 99.2. One day it was a high of 100.2. Had achy muscles, especially dorsals, tiredness, not much energy, but did sleep well. On Sunday, the 1st, I think it was, of March, I began to have a cough.
Okay, so it was about 9 days after you got off the boat, right?
Yes.
Right? Yeah. So your cough, would you call it dry or productive?
It was somewhat productive.
Okay. And someone's also asking, your normal medical care, is it traditional or holistic?
I have one annual physical from my primary care provider, which I had mid-January. Other than that, most of my care is chiropractic and holistic.
Okay. And what's your typical vitamin regimen and diet?
The last 3 months, I've changed the diet. I've gone to a gluten-free and dairy-free diet. Other than that, pretty balanced. I like my meats, fish, chicken, vegetables, fruit, some desserts.
All right. And were you on any supplements during the cruise or when you first found out you were sick?
Yes, I tend to be a heavy supplement taker, lots of vitamins, minerals, red rice yeast for cholesterol.
Everything Angie said.
And there must be at least a dozen supplements that I take.
Okay. And how many days from your first symptoms did it take until you progressed to the pneumonia?
Well, let's see, the first symptom, that brief
Right.
diarrhea on the 24th, but for sure the 26th, the fever, and the fever, low grade fever that afternoon, evening continued for 11, 12 days until Saturday. And in addition to the fever, they took a chest x-ray and diagnosed pneumonia.
Sorry, we got a little bit caught off there. There was some volume on when somebody came in. You were diagnosed with the pneumonia when?
On Tuesday, March 3rd,
okay.
by x-ray.
By x-ray. So that was about 11 days after you got off the boat. Mm-hmm.
And, had the fever then too, of course.
Sure.
At that time, I just didn't have any appetite or thirst for about at least 3 days. It was not good. I wake up early in the morning, often with sweats. Then thought Thursday the 5th, the thirst and appetite started coming back. Saturday, the 7th, we borrowed an oximeter to measure the blood oxygen level, and noticed that evening it was 84, 85.
I remember your wife saying that she really felt like that was the best tool for you guys to know when it was time to get you to the hospital, and probably saved your life because
it could be. Right. We tried to then use my CPAP, which brought it up to 88 to 90. And we thought, well, okay, it'll be fine to sleep the night that way. About midnight, I woke up, kind of a little tired, tight feeling in the chest. We took the oxygen level again, and that was back down to 85. That's what we decided.
We're talking about the pulse oximeter that you put on the tip of your finger, right?
That's right.
Okay.
So then I know that low oxygen, can be a problem. With other things, heart and so on. So that's when I decided to go into the ER, because it'd been like 11, 12 days, the fever, flu-like symptoms, and tiredness. Okay. And then the cough for almost 6.5 days by then.
And somebody's asking, when you were admitted to the hospital, did they run some blood tests as well? And are you even aware of those yet? Have you gotten a copy of them? They were asking what your white blood cells and lymphocytes looked like in the hospital.
We advised them that I was probably positive for corona, because on Thursday, March 5, I did go to the public health department, had the swabs. The morning of the 6th, they called me and said, it's presumptive positive. They're going to send it on to the CDC in Atlanta for confirmation, which I really never did hear back either way, confirmation. So we went under the assumption that it was the corona virus. And my wife is saying something. What, Alice?
2 things. I read the paperwork from the county, and it said that you were positive for coronavirus.
That's what the paperwork says. When I talked to the manager down at the public health department, they said it was inconclusive, so they put it down.
That's what they're saying. And to everybody at the county level and even the clinic level now, they're saying presumptive positive and sending it off to the CDC. So there was that lag time where you didn't really get a definitive answer.
That's right. And I still haven't really got a definitive answer.
Well, I'm glad you're out of the ICU.
Yeah. So, but we advised them at the hospital that we probably corona. And so they were prepared for that. They come out to the car in their full hazmat uniforms. Wow. And took me into a special ER compartment that was negative pressure. A lot of fan noise, bright lights. Everybody, the nurses in there were in full hazmat uniform. They drew blood, of course, IVs, put me on oxygen, took an X-ray. And what I've heard back is from the different days in the hospital, the 5 days, that the blood tests were normal. 2 days later, I spoke to the hospitalist, who's a friend of our neighbor, who is a well-known physician here in our area. And the hospitalist told my neighbor, the doctor, that, we don't know if he had bacterial pneumonia. We just assume that when there's a compromised health condition, that other bacterial problems could develop. So they put me on 2 different kinds of intravenous antibiotics, and of course oxygen, and then the respiratory treatment, the albuterol, 3 times a day.
And then somebody asked too, one of the other hallmarks to COVID-19 pneumonia is different x-ray appearance. Did they talk to you at all, or did you get to see your x-rays, and tell us about that?
I asked that. I believe I got a positive confirmation back on that. There was obviously fluid in the lungs on Tuesday at the Meds Health Center, the 3rd of March, and then again on the 8th, early on the 8th, I took an x-ray, and there was fluid there again. And then again, 2 days later, the 10th, there was still fluid in the lungs. And on, I think it was Wednesday or Thursday of this week, there was still some fluid in the lungs on the x-ray. Alice
went through like a time of,
pardon me?
When
Hold on, there's some folks that have joined that aren't muted, so let me just mute them all.
I've got something to say.
Okay.
My wife has something to say here.
Go ahead.
Okay, when we were in urgent care, the doctor said there were spots. There were little spots in different areas on his lungs.
On the x-ray.
On the x-rays. And it was not the typical pneumonia as of then. I got to see the x-rays after they took them in the hospital, and it was very strange to see it was a cloud on the lower lungs. It was very, very cloudy, with little tiny spots all over. It wasn't the typical pneumonia.
Yep.
And I asked the nurse next to me, I go, that's the coronavirus, isn't it? And the nurse said, yes.
Yeah, that's some of the feedback that people are sharing too in the chat boxes. That's more of the classic corona presentation before it can become life-threatening. Yeah, so you did a great job catching it with the pulsometer and getting him to the urgent care when you did. That's for sure.
Yeah, it looks like it. Yes.
Yeah. So some other questions that came in. Again, while you got this particular virus, it seems that your spouse, who was with you on the cruise, didn't. Is that correct?
Correct. That is correct.
And so what was she doing differently? Any supplements that she was taking, or any regimen that she might have been doing differently that would?
I think she was doing a better job of the supplementation. Let me have her respond to that.
I'm here. I want everybody to know that Paul and I have followed Angie's advice for a long time. I continued to take the loracidin.
Yeah.
Loracidin, the monolaurin. I was taking it a couple of times a day. I really feel that built up my immune system. So I didn't catch it. And I also was taking the probiotics twice a day, the ones that you recommend.
I've been
doing that faithfully, and it really saved my life.
I found it interesting that Dr. P talked about the early symptoms of the diarrhea, because that isn't a symptom that's really been talked about much with other folks. And it's not necessarily something you normally think of with a flu either, right? So that I found that curious, but we're all different. And so it may not be a standard.
Well, I pointed that out to the physicians, and did not seem to impress them.
What's that?
I did point that out to the different physicians, the MDs, but they did not make major note of that.
Got it. Interesting. Okay, so somebody's saying diarrhea is becoming present on and off in other cases as well.
Oh.
And they were asking how much monolaurin. Alice, at the time that you guys were on the boat, how much monolaurin were you using?
I was using it twice a day.
The 1 scoop twice a day?
1 scoop, not, a level scoop or a little bit less. It depends how much. I have to take it with food. I try not to, but it depends. But I'd say 2 level spoonfuls a day.
And remind me, were you also using the TH2 support while you were traveling?
I was not.
Okay, but you've started that again since you got home,
yes,
right?
I have.
Okay.
But I misremembered on the monolaurin. thinking it was antibacterial. So I had not been taking it for
Sure.
a couple of months at least, maybe longer.
Sure. Okay. All right. And then one of the things we chatted about earlier, and I had thought Alice said she had started doing it at home, but the deep breathing. So Alice then reminded me that her deep breathing she does for anxiety purposes. But one of the things we've been hearing recommendations on the news is also for people to take a really deep breath in all the way to the diaphragm and hold it for a count of 10 every morning. And if they gasp or cough or can't hold it comfortably, then it may already start to impair their lungs.
Probably good advice.
I do it for 3 minutes a day.
Awesome. Awesome. So you do it as a meditation practice, right, Alice?
Correct.
Great. So what did it feel like, Dr. P, to be quarantined in the ICU? And if you're willing to share what treatments, I know you mentioned the IV antibiotics and the albuterol. Is that all you had to have done?
Yes, treatment wise, basically, I mean, they do the normal, give a little shot for blood thinning and because laying in bed to prevent the
Sure.
blood clots. Later on, after about 3-4 days, they started giving me probiotic. That was basically the form of treatment. The emergency room experience was very unpleasant. You're wearing a mask and it's hot, and all these people in the hazmat suits and all this stuff. Once I got to the intensive care unit, then I become hardwired to many things. Of course, the blood pressure cuff 24 hours a day, checking the blood pressure every hour, the oxygen sensor taped to your finger, the oxygen in the nose, EKG leads going to the computer. Very restrictive, very restrictive. The intravenous antibiotic therapy, one arm would be a half hour, the other would be an hour and a half.
Wow.
Did get phlebitis in the right elbow, still have from the IV in there, probably a little too long.
Okay.
The one on the wrist seems to be okay. You have to go to the bathroom. If I had to have a bowel movement, they had to come in and unhook many of the things, but left some of the things hooked up. Go to the stool right there in the room and try to get the functions working, which they did. I had no problem with that, and my appetite was fine. So all the other functions seemed to be fine. Again, what they reported to me on the blood tests came out normal.
Great. Okay. But we know from a functional perspective, it might not have been ideal, right?
Not at all ideal.
Right. Right.
Honestly, I've decided since then, I do not want to die in an IV in an intensive care situation, especially from respiratory problems. Send me home, hospice or something else. That's not a way to go.
And there was no one else being treated for COVID at the same time you were in that ICU, was there?
I don't know. I think there might have been one other one, but I asked how many and they said it's just been very few so far.
Okay, good. So I know a lot of us have been paying attention to the curve that's been coming out, looking at the rate of infections in China and in Italy and now in Germany. And, they're talking about the social distancing that they're trying to talk people into doing now in order to flatten our curve so that we don't all get exposed at the same time, and that those who are going to progress to pneumonia don't all have to hit the hospital at the same time, because that could be disastrous.
Right.
So if you were still actively in practice, another question that came in, if you were still actively in practice, assuming that you hadn't already been exposed, what precautions would you be taking or would you be advising at this time in your practice?
Well, obviously, clean the surfaces thoroughly, regularly during the day, countertops, right? The desk, doorknobs, edges of doors, all that sort of thing. I think another thing I would do is that between every patient, I'd go wash my hands and come into the new patient room or area, wiping the hands on the towel so they know I have done it. Obviously be a little careful of those with the cough, and especially productive cough. At least that's my initial thoughts to that particular answer. My assessment of my condition is a viral pneumonia, which the body's got to heal in itself. And you got to get the body strength up the best you can, the immune system functioning optimally. Most times, as you know, we fight things off like that and go on.
Right, but this one really pulled you down quick.
Well, it took about 12 days, 12 days of the fever and flu-like symptoms before I went into the hospital.
Someone asked if you had done anything differently. If you, now looking back, would you have done anything differently, or would you make any recommendations for others?
Well, I kind of think how I got exposed on the ship. It was in a theater, back row, 2 empty seats between me and a lady that was coughing badly. So that's probably where I got exposed. And I'm guessing it's a much more virulent virus than most. Other than that, I mean, I was getting adequate rest, adequate diet, obviously on a cruise ship. And we've been around a lot of people on cruise ships. We've been on like 141 cruises. So my assessment was that my immune system had developed some degree of immunity towards most organisms like the norovirus and so on. So we have never been concerned about going on that kind of an enclosed surrounding before. But I think I might want to rethink that because of my age and now having pneumonia.
Yeah, and they are saying that this virus is much more virulent in that way. Up to 6 feet, the virus survives in the water droplets. So if it were in her sputum and she coughed, it can survive up, in the wet fluids for up to 6 feet.
And on surfaces.
Correct. Yeah, once it hits a surface. Right, exactly.
And and the cruise ship, you're having your hands on railings regularly. At least I did,
Sure.
So who knows? And they said on our cruise ship, one of the people that got the coronavirus was a waiter. So, who knows which waiter that was.
So Alice, there's a couple questions for you if you're comfortable sharing.
Alice?
Somebody's asking, can she hear me?
Yeah, she stepped out of the room. Let me
Okay,
see if I can get her attention here.
We can get back to it.
Well, let me see if she's close by. Alice? They had a couple of questions for you. She's coming back. What I've done here at home, I've self-isolated into the master bedroom and bathroom, and not to the other areas of the house. When I left the hospital yesterday, they said, do that until 3 days after involuntary cough is gone.
Okay.
Yeah. So,
and you're working on your lung function every day at home, right?
Yes, the inspirometer, keep the lungs fully inflated. And it's still, when you take about maybe 3-4 times out of 10, that'll stimulate a little bit of a cough and full inhalation. And it can be a little bit of a productive cough, which they're encouraging, of course, try to get that out of the lungs.
Yep.
So, yeah.
Yeah. So one of the questions somebody asked is, do you feel like you're fully recovered at this point, or do you still feel compromised and recovering? So that answers it a little bit.
It's about 95%, I would say, recovered.
Great.
I feel fine.
I feel fine. Your energy felt good, right?
Yeah, I mean, I was not physically active in the hospital, of course, nor very much the days before. So, I think I'm a little deconditioned, but
Sure.
Other than that, I feel fine.
Okay.
Okay, and Angie, I wanted to comment that when I spoke to the health department, the lady told me that the test was positive, and because it was positive, they automatically have to send it to the CDC for confirmation. She told me that this morning, Paul. And it showed on the test results that there was coronavirus. I read it this morning that on your swab there was coronavirus in it.
And that was still from the original swab, or
that is from the original.
Okay.
We never got the final confirmation that we got to call and ask, I guess, about.
That's a little embarrassing that the CDC never even bothered to get back to you.
I know it.
No, I mean, they've all kinds of reasonings. They're really, really busy. All of them pair tests apparently been going down there. But still,
I guess it was a little important for the ICU docs to know that you probably needed to be in quarantine. So it's a good thing you thought enough to warn them.
Yes, otherwise we would have probably gone on in the general emergency room environment, which would, could have spread things.
Sure. Sure. Okay. So Alice, if you're comfortable, there's a couple questions for you.
Sure, no problem.
They wanted to know more about your health conditions and what probiotics you were using at the time of the cruise.
I use the one that you recommended, that Health and Wellness.
So Culturelle.
Ultra yes.
That's the one I was using too.
That's the one, you know.
I was using the same one.
Okay.
Right, but I have been using mine twice a day for months and months and months.
And me only once.
And Paul only once a day, if that makes a difference.
Sure.
Me, twice a day.
And how was your health at the time of the cruise?
You know, on the first cruise unfortunately, I came down with anxiety and panic attacks about 6 months ago. And I've been trying to get that under control. So when you have anxiety and panic attacks, you exhibit different symptoms.
Sure.
It's, you know, like you think you're having a heart attack, you have left arm pain, you think you're coming down with allergies, and then they go away in short order. On the cruise,
First one?
on the first cruise to Hawaii, I had something. I had a runny nose. I had a cough. Maybe I started taking the Monolaurin 3 times a day.
Okay.
I think I took some of the, I always take extra probiotics. I think I took 3 a day for a couple of days. I stayed in bed and I rested. And after 3 days, I was fine.
So just to kind of catch people up with what Alice is saying, Dr. P and Alice cruise a lot. And so they were on a cruise prior to this one where they were likely exposed to the coronavirus based on the time of the symptoms. So Alice possibly had a little bit of immune suppression on the first cruise.
Right.
And got on all the supplements or was already on all the supplements and was still on them during the second cruise.
Correct.
And somebody was asking, what are your deep breathing exercises?
Okay. Oh gosh. Now you have to make sure you get your stomach muscles to work with your breathing.
Mm-hmm.
Okay. When you inhale, your stomach muscles, you have to extend your stomach muscles. Inhale, exhale. It's the opposite of what you think. I would think it's interesting. It's like,
but it's a deep inhalation, right?
Right.
It's
So that you're
very,
getting
very
all the way into your diaphragm,
you
dropping your
blow
diaphragm. Yep.
your air, when you blow out the air, you extend your stomach.
And what
But
was
The muscle in your stomach, you extend it.
what was
So
your
I
cycle
think
of breathing, Alice? How many breaths
it would,
in? How many?
How many reps?
It would be, I would do 4, 6, 4.
In what period of time?
And when you count,
Oh,
you
and she said-
inhale to 4, exhale, hold it for 6, and then exhale for 4.
oh, okay.
And she said previously she did that for like 3 minutes a couple times a day, right?
At least once a day.
Okay.
When I was getting nervous, I would do it twice a day. Or anytime, in order to reset myself, I would do 3 or 4 or 5 of those, and then I would feel the panic go away and I'd go on.
And I think that usually helps blood pressure too, doesn't it?
It does. It would lower my blood pressure. Also, another thing that I've done, I've been doing tapping, and I don't know if
Sure.
in conjunction with the vitamins, I did a tapping for anxiety. And after a half-hour session of tapping on health, that I'm healthy, my blood pressure dropped 30 points.
Awesome. And so throughout all of this, when Dr. P was in ICU, you were quarantined at home. Is that correct?
Correct. I was quarantined at home, but I had support from we have 2 wonderful doctors, neighbors that we've had for 37 years across the street. They would be constantly texting me and checking up on me.
Awesome.
And when I'd have a question or an issue, I could turn to them. It was wonderful.
So
But it
Dr.
was
P,
lonely. It was lonely, and and you wonder, because when I left the hospital, I mean, I got so scared.
Yeah.
The doctor turned to me, or the nurse turned to me, handed me Paul's bag and said, "You're under quarantine. You cannot come back until you pick him up."
Wow.
And escorted me out the door. And that's the way I was treated.
Okay. Understandable, but still really scary, huh?
It was very, very scary.
And Dr. P, one of the ladies, the chiropractors on the line, is asking if you would feel comfortable sharing your hospital lab results with me through our patient portal, and I'll strip some of the specific information out of it to make it private, but sharing some of the numbers. So from a functional perspective, we can look and see what was going on.
Sure,
We can do
sure.
that. Once we figure out how to do that, we'll be more than happy to.
I'll
Yeah.
walk you through it, Alice. It's all good.
I'm not sure what all figures. Every time I asked about the blood test results, they said, white blood cell count normal, this normal, this normal. Everything seemed to be normal.
Wow.
It was just the X-ray, the oxygen level.
I get the paperwork. I think we can do it.
Oh, she's going to maybe look for the paperwork right
I
now.
can walk you through it later too. That's fine.
We can do it later, Alice, too, that she
And
said.
one of the other questions that came in, somebody asked, do you agree with the current intense amount of fear and precautions? I would clarify that and say, people are walking around fearful, but now we have our states of emergency going on within states and the federal government. So what are your thoughts on all of that based on what you've been through and watching what's going on in China and Italy?
My assessment from kind of a reporter on the scene, I guess, and obviously background on healthcare provider also. My thoughts are with what I've been able to glean, that of course, the elderly and the infirmed or people with weakened conditions are the most susceptible. So I think those groups should be the most careful about being out in the public, try to build their immune system as much as they can. In final analysis, they got to fight off the virus.
Yeah.
Other groups, I don't think should be so concerned. I mean, as long as they, watch their diet, you get some supplementation, you get chiropractic care, get adequate rest, try to keep stress under control.
Yeah.
And obviously wash the hands thoroughly on a regular basis. I think the general public should not be alarmed.
Now, I look at it differently. It's interesting.
Okay.
Because when I was in the hospital, Paul was laying there, and I don't know if he could hear him, when they said to me that we don't know what to do for you. And then doctor said to me, I don't know if he's going to live. We're going to give it our best shot.
Right. They're being honest because they don't know.
They're being very honest, very, very honest. And I was listening to the TV last night, and I was trying to get all sides. And basically, I feel maybe it is a little extreme, but basically, we don't want to get into the same situation that Italy is in.
Right.
Because if it happened over here, we don't have enough manpower. We don't have enough hospitals. We don't have, as our governor stated, now they're going to use hotel rooms if they have to put people in them.
Wow.
That in Italy now, they're letting a lot of the older people die to try to save the younger people. We do not want to get to that point. And I think, 2 or 3 weeks of this mass quarantine or not going to certain events, I personally think it's a good idea.
I selfishly told Dr. P if he had to have it, I'm glad he had it early on, because I too wouldn't want to see what it's going to be like for someone who gets to the lung compromise that even Dr. P got to, which I think was, you guys caught it early on so it can be fixed, when the hospitals are busy. Like, I can't imagine what it's going to be.
One thing that I might comment on that was a little frustrating to me, we asked the nurses or asked the hospital doctors about things. They just didn't seem to have a clue. It was so new to them. The information kept changing day to day to them. So it was not very comforting, even though I was early on and, they're
Sure.
kind of experimenting with me. That was a little concerning that they weren't sure what they were supposed to be doing. And when I was released for sure what precautions would one has to take and so on. So they're kind of feeling their way themselves.
I have a question too about whether or not, and you may not even know, do you remember hearing if they gave you that new experimental drug called rifaximirab?
No, I don't think they did.
I don't think they did either. But
Interesting.
our oral instructions are different than the written instructions. That's all I can tell you.
Okay.
Yeah, so they're just kind of learning as they go.
Did anybody mention or talk about vitamin C while you were in the hospital?
No.
Of course not.
They did put them on probiotics though.
The probiotics are after a couple, 3 days.
Because you asked, right?
No.
We
I
talked
don't remember that. I don't
Well,
remember.
you and I talked about it the first day you were
Right.
there,
Yes.
Maybe
and you
did.
said you were going to
I
bring it
may
up.
have asked, but I don't remember for sure.
Okay. Let me see if there was any other questions. I'm not seeing any other direct questions. Anybody else online? You can unmute yourself now and ask a question if you want.
I was on oxygen 4 liters a day for about 2 days, and then we cut it back to 2, and then the 1 that night, and then the 4th and 5th days I was on room air, and oxygen level was 96. One day 98.
Awesome.
They did say because that Paul was a low risk patient, only because he doesn't have any underlying compromising issues, any health issues.
Yep.
And that was in his favor. They did say, the lady that I spoke from the Department of Diseases at the hospital did tell me that there was somebody else in the facility with the coronavirus in very, very bad shape. I go, critical care, and she goes, yes, but he has a lot of compromising issues, and his wife also has it. So I felt very sorry. Paul was very lucky, but a lot of it, as I said, I think it's the chiropractic care, it's the regime that you have put him on, and that he has been on for the last
3 months.
Well, the last 40 years, we've been taking
Sure.
care of
Oh, yeah.
ourselves as best we can.
Well, yeah, that's right. Yeah.
Right.
For-
You're not new to the rodeo.
Right.
Right. Let me see if there's any other questions that anybody was asking. Okay, so yeah, people are talking about, there's a really good study showing natural agents that may go after the vulnerabilities in this virus. What else? People were asking to know your exact nutritional regimen when, I assume, Sharon, when you're asking that he was on when they were on the boat, or what they're doing now?
On the ship, I was on a gluten-free diet. It was too difficult to be on both the gluten-free and the dairy-free on the ship. So I was just on the gluten-free on the ship, and a very varied diet, very balanced diet, ample amount of food of all types, including desserts. Before the cruise and 25, after the 25-day cruise, then I went back on the dairy-free diet in addition to the gluten-free. What was the second part of the question? I think I did not answer it fully.
The exact supplement regimen that you were on while you were on the boat, and
oh boy, obviously calcium, magnesium, potassium, CoQ10,
a B complex,
zinc, probiotic, red rice yeast for cholesterol has worked really well. Vitamin B and B12, and vitamin D under the tongue. Horse chestnut for blood circulatory system. Like a fish oil. Oh my gosh.
you were using cod liver oil, right?
No, I don't think. Well, I'm not certain it was cod liver oil. Let's see. It's like an EPA, DHA.
EPA, DHA, yeah.
Yeah. Yeah. Number of supplements like that.
Yeah.
Lutein for the eyes. Another one generally for, I think, heart health.
So Sharon, we'd probably have to write it up specifically.
Yeah, there's a lot.
Yeah. I mean, when you those of us that are in the field tend to kind of have, if you will, our little chest of what we hit, daily versus what we hit when we're feeling like something's hitting. And yeah, they definitely have a few between them. And Alice doesn't necessarily do the same things that Dr. P does.
Correct.
For different reasons, right?
Now I should say probably on the cruise I wasn't taking quite all of those, maybe
Got it.
A dozen. I think I left out 2, 3, 4 of them at home that I did not take with me on the trip.
So for everybody that came in a little bit later, Dr. P is 75 years old. He was a healthy person before he got hit with the virus. He cautioned that I said exceptionally healthy. He was maybe not exceptionally healthy, but he was quite healthy before he got infected. It took about, what did we say, 9 days to start developing the fever and the pneumonia since his cruise. But the cruise itself was 10 days long, so we don't know exactly what day during the cruise.
That's right. Actually, after getting off the ship, I started having a fever and flu-like symptoms within, let's see, it was a Friday, then that Tuesday afternoon is when I first started. So about 4 or 5 days.
Got it. But this is, you said, probably your 130th cruise, so you're not new to that.
A little more than that, actually.
Okay. So yeah, Dr. P goes on a lot of cruises. He has a great relationship with quite a few cruise lines and has done some work for them as well. So, but you said you're possibly questioning that theory now with
well, because of my age and now having pneumonia. Other than that, I wouldn't hesitate at all. But just because now older and had this issue with the lungs, you got to think a little differently.
Awesome. And someone else is saying they'd love to see a picture of you and your hands close up in order to look, again, specializing in different nutritional examinations, right? So you and I can chat about that. We can maybe exchange a photo and do that
sure.
with this individual. Anything else that you would share with us in general, Dr. P or Alice, just to help other practitioners?
Yeah, obviously look out for fever and cough or respiratory distress.
Difficulty breathing.
I think those are the two main things.
And again, Alice caught yours early on using a pulse oximeter to see.
Well, not early on, no.
Well, when I say that, she caught the pneumonia and the breathing issues quick enough to get you to the hospital in time. We
weren't checking the oxygen until about 6 days after I started the cough. We did not have that equipment, so that would be advice to monitor that earlier. Good. Yeah. Okay. Yeah. My general, I guess, summary is that, I think I had the coronavirus. It resulted in viral pneumonia. Doesn't seem to have any other problems health-wise as a result of it. The oxygen and the respiratory treatments with the albuterol seem to be the most effective. I don't know how to assess the antibiotic. Even the doctor said, we don't know if you had it. We just do it prophylactically. And in fact, I'm still on it for another 2.5 days. As soon as I could, I got up and would sit during the day instead of lie, do a little bit of leg exercise, arm exercise, breathing exercises. I'm an optimistic person. I was, pretty convinced I was going to be fine, fully recover. But it changes your views a little bit on life in general. Yeah. Yeah. And lastly, you said you're still on quarantine in the home until a few days after your cough stops, right? That was the instructions as of yesterday, and who knows, that could change. Okay. And when you left the hospital, supposedly you had a test that was negative, correct? Well, the blood tests had been negative, I think, all along. I mean, the COVID. So this is the other thing. Again, those of you who came on late, they had a presumptive positive COVID test before he went to the ICU, but CDC never got back to them on that. And then you said when you checked out of the hospital, you were supposed to have 2 negatives before they'd release you. And oh, no, I didn't know about that. That's news to me. Okay. Alice told me about that. She said you had to have 2 negative tests before they'd release you from the hospital. And then she said, they're still not sure if it was negative. Well, they never did retest it. The original test on March 5 is the only test I've had for the
Are you
corona.
serious?
Yep. They're going to
Oh.
retest me this coming Monday.
Wow.
And my question is, how accurate is the test?
Right. And they told you to stay inside 3 days after your cough is gone, but they don't even know if you're negative yet.
Well, stay in quarantine within the house, my own bedroom and restroom, so I don't expose Alice unless I have my mask on.
Okay.
It said after 3 days, no cough, then I can go about the house with no mask and no concerns.
Okay.
But we still don't know if I should be staying, in the house or go out into the public. We don't have an answer on that.
Wow. It just feels like they can do a whole lot better from a public health standpoint, right?
Yeah, because there was not much guidance for me.
No.
There really wasn't. I mean, they're kind of feeling their way.
Yeah, or Alice for that matter. I mean, right, as a spouse of someone who's positive, they just basically told her quarantine yourself. But yeah, it was voluntary quarantine, which is great. You guys are responsible that way. But there's a whole lot more we can do there. Everybody's saying thank you so much for your generosity and
Oh, no problem. If you have follow-up questions, please let me know, because if I can be helpful,
great.
Like I say, I was kind of an early reporter on the scene. So I'm trying to do my best to
Inside, whether you liked it or not.
I'm sorry?
Inside reporting, whether you liked it or not.
Yeah, that's right.
So just an aside, everybody, if you have any questions, you can either unmute yourself and ask live now while we still have Dr. P, or you can write something in the chat box. Otherwise, we're going to sign off.
My summary is to keep your body as healthy as you can. Keep that immune system up. Adequate sleep, adequate nutrition. Try to keep a positive mental attitude. I mean, I think it all makes a difference.
Yeah, because in summary, again, just most people here know this, but of the entire population, they don't know, maybe 40 or 50% may get sick, but of those, some may be asymptomatic, may not even know they're sick. Some may have very, very minor symptoms, maybe a cough, a little bit of difficulty breathing, but never even have a fever. And they may get over it just fine. But they're saying that of those who are immune suppressed or elderly or have any of the other high risk factors, they are at higher risk. And that's where we're talking about paying attention to the breathing and watch for the lung function, get a pulsometer. They're pretty cheap, pulse oximeter,
Yep.
and watch for that.
And fever.
Exactly.
Yeah, but you know as well as I do. I mean, we've been exposed to multiple viruses in the past in the same scenario, basically. A certain percentage. I mean, it's sort of like nature's way of weeding out the weak. But most of us develop immunity and go on, don't even know it.
Yep. Awesome. Thank you again. I really appreciate you guys.
Did anybody want to unmute and ask questions while I'm on the line?
No more questions have come into the box. So awesome. Somebody says I may come up with some later. So if she sends them to me, I'll be certain to ask you, Dr. P. And everybody's saying thank you. Thank you very much for coming and speaking with us and taking the time to share your experience. And
one other thing I might say, it was comforting, Angie, personally, with consulting with you, knowing, what we got to do afterwards, how to get the body back to normal after the antibiotic therapies and all that sort of thing. There are things that can be done. We've learned new things about this virus that works better than previous treatments and supplements. So that was very comforting to have somebody like you that has that knowledge, knowing that, whoa, I got somebody on my side that knows a whole lot more about nutrition than I do, that is going to work with us on this and get my body's strength back so I don't become susceptible to any of the future problems.
Sure, you bet.
Yeah.
Awesome. All right, everybody's saying thank you again. Appreciate you being here, Dr. P.
You betcha.
Take care, everybody. Thanks for joining us. Bye-bye.
Bye-bye.